This instrument is your favorite Vulsellum. Vulsellum. Some textbooks call it Vulsellum, some textbooks call it Vulsellum. जो आपको बुलाना हो, it is Vulsellum. Okay, this Vulsellum, again, finger bows, then ratchet, okay, lock, blades, and इसका जो tip है, this tip has multiple teeth, right? 2, say 3, there are teeth at the end to grasp something. What is it being used to grasp? For what are we using? For what are we using to grasp? Tell me. Correct. Cervix. We are using to grasp the cervix. It is used to grasp the cervix. Okay. After grasping the cervix, what do you do with it? After grasping the cervix, what do you do with it? क्यों कर रहे हो ग्रास्प सर्विक्स को? क्या करना है आपको सर्विक्स ग्रास्प करके? ओपीडी में क्या कर सकते हो? After grasping the cervix, I can pull the cervix down. I can assess pelvic organ prolapse. In the OPD, I can hold the cervix, use a punch biopsy forceps, and take a biopsy of what? The growth on the cervix. So it can be used for cervical biopsy, right? Then it can be used for, I can hold the cervix, insert a curette, and take sample of the endometrium. I can use it for endometrial biopsy. What else? I can grasp the cervix and I can insert, say, a ring holding forceps, twist it and remove a polyp. I can use it for polypectomy, right? Then I can use it for what? Insertion of intrauterine device. Insertion of intrauterine device. I want to hold the cervix to insert a screw-like structure into the cervix and insert a dye into it. Leach-Wilkinson's cannula. I can use it for HSG. Apart from that, I can use it for vaginal hysterectomy. Right? Vulsellum को ही use करके आप cervix को पकड़ते हो और उसको नीचे खींचते हो, so that you create a plane for hydrodissection. Right? So vaginal hysterectomy के लिए आप use कर सकते हो. Lastly, when you're doing a fibroid surgery, myomectomy करते समय you have to, after creating the plane, जो myoma के around pseudo capsule होता है, वो pseudo capsule तक आप पहुंच जाते हो, and you create the plane, then you have to hold the myoma, twist it, and remove it. Usually for that, we use a myoma screw. Or we can use any other instrument which has a good grip. And that grip can be provided by your Vulsellum. So an offbeat use, it is used for myomectomy. Right? Now, ये जो हमने cervix पकड़ा, cervix पकड़ने का काम तो myomectomy में नहीं होगा. So grasp the cervix. Whenever we are grasping the cervix, we are grasping the anterior lip of the cervix. We are grasping the anterior lip of the cervix, right? So by grasping the anterior lip of the cervix, we are doing all of these procedures. Apart from that, without grasping the cervix, some other use, out of the track use, offbeat use, it is used in myomectomy, right? Now that we know the use, let us go back and see iska orientation kaisa hai. How is the orientation of the Vulsellum, right? If you see, जो Vulsellum है, it has a slight curve. There is a curve to it. There is a curve to it. Okay. Do you know why this curve is there in a Vulsellum? Do you know why there is this curve in the Vulsellum? Can you tell me why there is a curvature in the Vulsellum? Why is it a curved instrument? Okay, I'll tell you. So, helps to grip easily? No, not really. Not really. It doesn't give a grip. ग्रिप तो उसके टूथ से आएगा ना, उसके कर्वेचर से ग्रिप तो नहीं आएगा. ओके, आई टेल. करना क्या है वल्सेलम से? सर्विक्स पकड़ना. बट सिर्फ पकड़ने के बाद सर्विक्स को देखना भी तो पड़ेगा ना. तो कोई स्ट्रेट इंस्ट्रूमेंट होगा, उससे आप सर्विक्स पकड़ोगे, तो इंस्ट्रूमेंट बिकॉज इट इज स्ट्रेट, इट विल कम इन योर व्यू. It will come in your view, right? You will not be able to see the cervix. But because it is curved, देखो, स्ट्रेट इंस्ट्रूमेंट होगा तो ऐसे सर्विक्स पकड़ूंगा मैं, तो मैं यहां से देख रहा हूं तो सर्विक्स के साथ इंस्ट्रूमेंट भी दिखेगा. बट इफ इट इज कर्व्ड, what will happen is that because of the curvature, after holding the cervix, because of the curvature, I can still see the cervix, right? Because of the curvature, after holding the cervix, I can still see the cervix, right? So that is the beauty of it having a curvature. And second thing, usually when we hold any instrument, say we hold a needle holder, which two fingers are we using to hold an instrument? Which two fingers are we using? To hold an instrument, we use the thumb and the ring finger. You're right, Tejaswini. So thumb and the ring finger. But when you hold a Vulsellum, you don't hold it like this. You hold it using your thumb and your index finger. So आप बैठे हो, imagine you're sitting, you're doing, say, a procedure like you're inserting the intrauterine device. For that, you need to hold the cervix. So with the Vulsellum, you hold the cervix. You keep it such that the convexity is downwards. Convexity is downwards. And with the thumb and the index finger, you enter, you hold the cervix such that your curvature is upwards. And thumb and index finger आप use करते हो to hold the Vulsellum, right? So that then you can see the entire cervix. Okay, so that is how you hold the Vulsellum. Okay, so when you have this, you get the instrument in the Viva. Not only do you have to explain the parts, you also have to hold it correctly. If you're holding a needle holder, hold it as if you're using it. If you're holding, like anatomy में था bones, bones को हमें उसके anatomical position में hold करना है, वैसे instrument को उसके usage के position में hold करना है, not any which way. So Vulsellum usually you hold it with the thumb and the index finger. If you're assessing it in the examination, you're doing some surgery with it then. Okay, so that is the use of Vulsellum.